we have had, as private patients in our clinic, two leaders of the NDP. I mean, this is where how extensive the hypocrisy is going. We have had major trade union leaders, the nurses union that initiated this problem, the BC Nurses Union, was sending us private patients during the trial, as were the defendant in our constitutional challenge. The official name was named as the Office of the Attorney General of British Columbia. They were sending us private patients during the trial. So this is how extensive the hypocrisy is, that, well, a multitude of federal and local politicians of all parties, including the NDP and the Liberals and the Conservatives, have used private services themselves.
Canadians consistently tell pollsters that healthcare is their number one issue. I don't doubt it if you've been waiting in an emergency room and not got treatment and so many other issues. Brian Day has been a champion of patient care. He's an orthopedic surgeon. If you're not aware, he's been a former president of the Canadian Medical Association. And you know what? He's won so many awards. I'm not going to start listing them, but I thought it was kind of interesting. This year, he won the King Charles III Coronation Medal this year. He's also was named a fellow of the Royal College of Physicians of London. And as I say, it's a long list. But he's also the author of a brand new book, My Fight for Canadian Healthcare, a 30-year battle to put patients first. Brian Day joins me right now. Brian, first of all, congratulations on the book, and thank you so much for finding time.
Thanks, Michael.
Let me sum up the book by saying I think this is an essential read for anyone who cares about healthcare and is concerned or outraged by the fact that, as you chronicle, Brian, and have been chronicling, that millions of Canadians don't have a family doctor, or that 1.3 million Canadians left emergency rooms last year without getting treatment, or that Canada ranks near or at the bottom when it comes to timely access to a specialist after referral. I mean, the list is a long one, maybe the one that I don't want to oversimplify it, but it should at least ring an alarm bell, is that 33,000 Canadians plus died waiting for a diagnostic scan or treatment in the last couple of years. But still, that alarm bell doesn't seem to be ringing.
You're right, Michael. And I think it's, it's, even though those numbers are large, the reason is simple numbers. Like, most, if you don't need healthcare at this time, then the offer of free healthcare, so-called free healthcare, seems like a good deal. But then when you need it, it's not there.
Yeah. Well, and that's been the case for an increasing number. It's interesting. You've been, I'm going to call it a fight because it's cost you deeply personally and financially to try and fight for patient care. Do you think there's an attitude change on the part of the Canadian public as these things start, as they do over time experience some of these shortcomings?
Well, I think so. I think it's always been that way. I think in terms of, if you ask the question, do you think someone who is unwell, ill, waiting for healthcare, in pain, should they have the right to look after their own body when the government has promised to look after it, but then doesn't? Most Canadians would say yes. Now, it depends, but the polls showed that in the Charlie decision of 2005, where the Supreme Court of Canada legalized private health insurance for Quebec, the majority of Canadians and 81% of doctors supported the decision because it just made sense. I think one of the things few Canadians know is that of the almost 200 countries on earth, there is only one country where obtaining private health insurance is illegal in most jurisdictions, and we're in that country. Yeah. It's legal in communist China, in all the authoritarian countries, in Russia, in Cuba, and Laos, Vietnam. These countries that are communist countries even allow freedom when it comes to your bodily health.
I would think, I've been thinking a lot over the years of the hypocrisy that's involved in saying to me, Mike Campbell is a Canadian citizen. You are not allowed to access private care in these ways, for a medically insured, procedure. And then I look at, the politicians who do access care, the origins of the Cambridge Street Surgery Center to let injured unionized workers bypass our system, to jump in. I think that was 1996. NDP government at the time, I might add also. I mean, the list is just so long.
Well, yeah, we have had as private patients in our clinic two leaders of the NDP. I mean, this is where how extensive the hypocrisy is going. We have had major trade union leaders, the nurses union that initiated this problem, the BC Nurses Union, was sending us private patients during the trial, as were the defendant in our constitutional challenge. The official name was named as the Office of the Attorney General of British Columbia. They were sending us private patients during the trial. So this is how extensive the hypocrisy is, that, a multitude of federal and local politicians of all parties, including the NDP and the Liberals and the Conservatives, have used private services themselves. So I think, and the reason for the book really is that this has now gone through, it's gone through the government, it's gone through the law courts, it's now up to the people to demand change, because we cannot be the only country on the planet where the government considers itself as owners and controllers of your bodily health.
And I'll just say, don't wait until it's somebody in your family. I've had a personal experience, but I have a personal experience with my daughter who faced these challenges. And again, it's not that the people involved, I'm talking about nurses, doctors, other healthcare, don't want to provide the service, and they do a great service, but it's the system and the government that prevents them from, treating in so many instances.
Oh, yes. Well, so that was a conclusion in our constitutional challenge of the BC Court of Appeal. They came out and astoundingly, despite denying us the same rights as Quebecers, came out and concluded that the health system, our health system, is deliberately rationed to maintain fiscal sustainability, and as a result, patients are suffering and dying on wait lists, and also dying of the reason of, it's not just dying of incidental things, it's dying of the illnesses and diseases that they're waiting for. So, it's a terrible thing to realize that just one example of the, there are standards of maximum acceptable times that the BC government and the other governments in Canada have determined is the longest you should wait. And in, say, one category out of thousands of bladder cancer with a serious risk of progression. In other words, the doctors have diagnosed it. This is already spreading. We have to treat this. Only 16% of patients are receiving treatment in this time, within the timeline that the BC government itself has said is the maximum time it's safe to wait. And those 84% with their cancer spreading it's illegal. It's not legal for them to do anything about it in their own province. One of the things I talk about is the so-called Angelina Jolie gene. There's a gene that if a woman has this gene, she is going to get breast cancer. It's called the BRCA gene. And Angelina Jolie had prophylactic breast surgeries to deal with that risk. In BC alone, this has been a published study, 6 young women a year who are known to be cancer-free when this gene is discovered, develop breast cancer while they're waiting for over a year for this surgery to prevent them getting breast cancer. And it's illegal for them to do anything about it. This is bizarre. Like, this should not be the case.
I'm going to come back to something you said there, because a lot of people appreciate we have wait times and, over the medically acceptable amount. They don't realize that's by design. They don't realize that when governments came in that mid 90s and continue to this day, the way to control costs was to lower the level of, or the number rather, of people, professionals getting a doctor's or a nurse. So you lower it that way. But the other is a wait time. Hey, we don't have to, if we don't treat you, we don't run out of an expense. And I think people should understand that the wait time that you may be experiencing or family may be experiencing is literally by design.
As is the shortage of doctors and
Yeah.
nurses was a strategy in the 90s of the NDP government to close medical schools by up to 30%, cut back medical schools, and to close nursing schools. In the 90s, 1,600 nursing positions were cut back and medical schools were cut back. That's been the strategy. There was a subsequent premier who quite well, who reversed that and increased nursing training positions and also doubled the medical school intake. But you know who that person is, Michael.
Yeah. I'm just going to show the book again here, because I want people, I am encouraging people to go out. You can get it on Amazon right now and get it the next day. But this is the book with Dr. Brian Day. And as I say, because I think if you're interested in this stuff, just the history, but also what's going on, and you also talk about what they can do, and I'll come to that now, is that you recommend a public private sort of hybrid system, as you say, that is run in every other Western country in the world. But
Yes.
Again, that's had success in lowering costs, and I want you to elaborate on that, and obviously shortening the wait times.
Yes. Well, one of the things that's really bizarre, if you think about it, is it's actually cheaper, economically cheaper, to treat people quickly. And we proved this when I was president of the Canadian Medical Association. We did a study on just 4 procedures in 4 provinces, and during a 1-year period, the economic costs of the wait list was $14.8 billion. Now, if you extrapolate that to thousands of procedures, you can imagine how much it costs. The trouble is, these are longer term costs projected, and wage and economic benefits. But the point, the reason Canada is spending so much on healthcare, it's kind of logical. If you neglect an illness, it's going to get more serious, and unless the patient dies, then it's cheap. But if the patient lives and deteriorates, the treatment is going to be longer lasting. And it's the same with, say you get admitted to hospital, an elderly person admitted with a hip fracture. In the old days, we would operate on those patients within a few hours. Now they often fester around for a few days. They develop chest problems, they develop bed sores, they develop complications. They end up staying in hospital for sometimes months, instead of going home within a few days if they're treated quickly. And these costs are but those types of patient who lose that ability to return to their former self, especially the older patients, there are long-term costs. And the trouble with government running healthcare is it only thinks in 3 to 4 year financial cycles.
Yeah, great point.
The government today does not care whether a government 15, 20 years from now looks good with the economy.
It's funny, I just read a study, it was out in 224, talking about exactly what you're saying, the cost of wait times, in Canada. And I think they said the overall lost working hours for an average work week was something like $5.2 billion, or about $3,400 per the 1.54 million Canadians who are stuck waiting for treatment, in those wait lists. Your point's so well taken. And it's understandable. It costs us money not to deal with that, with this stuff. And let me come back to something I asked earlier. Do you feel that the public's acceptance now of a public-private care system, which, by the way, they should, because they've gone to a doctor's office, they've probably got eyeglasses, they go to a chiropractor, so it's not some foreign thing to most people, but I'm seeing a shift, at least as these problems manifest, and maybe they know someone personally or it's a family member?
Well, as you alluded to, it's not just eyeglasses, it's things like prescription drugs. I mean,
Yeah.
how nonsensical is it that you go to the doctor and are diagnosed with an infection and you're given a prescription for antibiotics to treat the infection? That's not covered.
Yeah.
You go to a pharmacy and you'll get a bill unless you have
Private.
extended health private insurance, and 70% of Canadians do. The other example that's even more bizarre, in my opinion, is you're hit by you fall off your bike or are hit by a bus or you break a leg in the street. The ambulance that comes along takes you to the emergency department, even if you're at risk of dying. That is considered a private. It's not covered.
Yes, right.
Unless you have private health insurance, and so 70% of us have that kind of extended health insurance, which is private health insurance. Those companies should be allowed to extend that coverage to cover everything if you're waiting an inappropriate time. And my answer to those who say, well, that's, for those who can afford it, what about the 30%? My answer to that is do what the Swiss do, what the Dutch do, what other countries, the New Zealand, the Australians do. Subsidize the premiums for those that can't afford it, but make Conrad Black pay the full price. So I remember the days when I used to get family allowance checks for my kids. So I would get a check every month or so, but then the government realized I didn't need it as much as the single mother in a lower income area of Vancouver, and introduced a means test, and I stopped getting it, and that person got double. So let's target the lower income groups, and as you know, Canada, of developed countries that have universal healthcare, the group that suffer the most in Canada are low-income Canadians. Yeah. That is bizarre. When we think we've got this wonderful system, there is nothing wrong with allowing those that can afford it to pay for private insurance. Those that can't afford it, the premiums are subsidized by the province, so they get it too. And I lived and worked in Switzerland for 6 months, and that's what happens there. So the low-income groups are sitting in the same private rooms with the same private healthcare as a wealthy person, and no wait list, no significant wait list. And this is how this. So in Britain, where they allow private health insurance, also, of course, the premiums for start are around $60 a month, and if you can't afford that, there's no reason why the state can't fund it for you.
Oh, the other thing that it still gets to me is that you mentioned earlier, you've had 2 court cases, your own court case in the BC Supreme Court, but the Supreme Court of Canada. But there's no doubt that people are suffering waiting for treatment. Like, that's not up for debate. And yet the answer in some quarters is don't change anything meaningfully. And then they don't look at other parts in the world who outperform Canada. The Commonwealth Health Index, it makes that very clear. They outperform Canada, especially in terms of waiting for treatment, waiting for a specialist. They're medically unacceptable wait times. Sorry, I'm going on, but it's unbelievable to me that we still maintain the status quo seemingly at all costs, a cost that you paid personally trying to change it.
Well, I think one of the worst things I find is, you talk about your daughter, we are actually mortgaging our youth. So
yes.
Our children, grandchildren, we're piling up. The baby boomers are already hitting the health system big time, and the costs are rising. We are in some ways victims of our own success. When Medicare was introduced, there were no heart transplants, there were no stem cell therapies, there weren't even, there were no MRIs, there there were no major surgeries for cancer. These complex surgeries we do now, and we're now getting into robotic surgery. These things did not exist. So what's happening now is we are introducing and these complex procedures when you can get them, there's a wait list, but we're borrowing the money, mortgaging our youth in order to afford that. And we are, one of the sad statistics is that the baby boomers are getting back more than they gave in.
Absolutely.
Next generation are going to be paying an awful lot more than they get back. And this is not right. And we, one of the things I do talk about, other countries, even the British National Health Service, they have hospitals, public hospitals, that generate revenue by opening on evenings and weekends and treating private patients, often from other countries. So, I talk, medical tourism is one of the fastest growing international businesses in the world. And Canada can't participate in that. The biggest customers are Americans. 2 million of them go abroad every year for procedures. None come to Canada because we close our operating rooms, and it would be politically unacceptable.
Right.
But that could be a revenue generator. Instead of healthcare being a cost, that could be a massive revenue generator for Canadian hospitals. I'm not talking about private hospitals, but the public hospitals, opening them on weekends and evenings, and using that revenue in order to expand care for Canadians. That's what they do in Cuba. Communist Cuba does that.
Yeah.
It's a crazy system that we are cutting ourselves out of that.
Yeah.
And again, to reiterate, the shortage of doctors was government and is government created. We have 3,500 young Canadians going to foreign medical schools, and half of them don't come back because they're young and they meet someone over there. And the other half that want to come back, we put barriers out for, because, as the BC Appeal Court said, we are deliberately rationing healthcare. We have a massive bureaucracy in our healthcare system. So for every health bureaucrat that Germany has, where there are no significant wait lists, and they spend about the same as we do, and they have a hybrid system. For every health bureaucrat in the public system that they have, Canada has 11.
Yeah.
BC has 64 vice presidents in their health regions, each probably earning $500,000 or more. That money should be cut back, and that money should be going into the treatment of patients. But when you've got a monopoly, as you know, name me one monopoly, which is what the government has in the funding and delivery of healthcare. Name me one monopoly that is good for the consumer.
Yeah. No, your point is so well taken, and there's so much there for individuals. And I'm going to come back. I don't want to put words in your mouth. I'm saying these are mine. That if you are serious about healthcare, and remember, every one of us ends up in this system somehow. Depends. I might end up as a 50-year-old. I might end up as a 90-year-old, but I'm going to be in this system. And I joked, Brian, that when people talk about their top issues, I said, believe me, none of those other issues are going to matter when it's your turn and you're waiting for care. And as both court cases, as I alluded to, said people are needlessly suffering, and as you alluded to, they're waiting a medically unhealthy amount of time. So I'm just going to hold the book up here so people can see it. I highly recommend it. Go on Amazon. You get it tomorrow, for goodness sakes, this miracle of delivery. But if you are interested in healthcare, you'll do something about it the way Dr. Brian Day has done with courage for Canadians everywhere to get timely and effective treatment. Brian, thank you for finding time. Congratulations on the book.
Thanks, Michael.